Dr. Gidon Frame is one of the most experienced and cosmetic injectors in British Columbia. Dr. Frame's mission is to manage and reverse total body and brain aging while optimizing facial rejuvenation. Dr. Frame is certified with the American Board of Anti-Aging and Regenerative Medicine. Dr. Frame loves to coach and teach people how to make their faces, body, and mind shine. He teaches at University of British Columbia as a clinical assistant professor and often gives educational talks to the general public under anti-aging topic. Thank you for being a guest on Omni Television. We really appreciate and admire your expertise in anti-aging, and I can talk this from my own experience. We try to understand aging. What happens when we age?
We fall apart, simple and plain. We have a buildup of toxins and metabolites that we just can't get rid of. We can't repair anymore, can't do any autophagy, which is the process of repairing. And our telomeres drive it probably. We have at the ends of the genes, the telomeres shorten and the cells can't reproduce anymore. You can't grow anymore, you can't repair, and you just start to decline. It's unfortunately pre-programmed. We've probably got death clock genes in us. And at a certain time in our lives, genetically determined, we start to fall apart, we can't repair, and it's downhill from there. We're all going to land up in diapers and dependence if we don't do something about it. And the longest we can live is 126. That's the record so far. Bible says 456, but you know, Jean de Comet, she made it to 126. But on average, those of us in the developing world, developed world, 84, 82, that's kind of the average. And there's not much you can do about it. You can try and fight it back. You're not going to live longer, maybe a few months, a few years. But our job as aging physicians is to get you to live as long as possible, as healthy as possible. That's the key.
What inspired you, Dr. Frame, to specialize in anti-aging medicine? Because you are also a family doctor. You work as a family doctor in the past.
Correct. I did family medicine for over 35 years. But in the last 25 years, I started to realize that MSP-based, Canada Health System-based family practice did not encourage preventative health. We were putting out fires. We were spending 7 to 8 minutes per patient. It wasn't working to actually empower people to prevent diseases properly, to avoid degeneration and aging prematurely, and actually manage their health actively. So that's why we decided to set up an anti-aging clinic where we dealt with the medical side of aging. And that was what we did. We did health, hormone optimization, menopause management, andropause, male hormone therapy, and general wellness. Then after about 21 years ago, we realized aesthetics fitted in with it. So we made the transition. We brought together anti-aging medicine, anti-aging cosmetics, and aesthetics. And the two together have just taken off beautifully.
Thank you. What are the latest breakthroughs in anti-aging science?
The science of anti-aging has come a long way, but yet it's fallen up woefully short. 22 years ago, when I started studying anti-aging medicine, we were all talking about telomere elongation, nanobots that were going to go through like robots through our body and heal us, gene technology. Not much of this has actually happened. We can make rats and worms and maybe dogs live longer. We haven't found the key to making humans actually live longer. We can live better, and that's anti-aging medicine. And there are some latest breakthrough substances and drugs that you may want to take if you're into the experimental field. For example, rapamycin. Rapamycin, of all the supplements out there, of all the drugs out there, probably prolongs life the most. But the evidence is only there in rats. So I have patients who are prepared to experiment, but for the general public, I don't think we want to be taking a drug that has been proven only in rats. But that is probably the latest, is the rapamycin and its control of the mTOR, mammalian target of rapamycin pathway. This is a very important pathway in the metabolism of an organism. And rapamycin low dose cyclic is one of those ways you can manage it.
Can you give us an overview on Botox, dermal fillers, and skin boosters? And what are the common concerns about injectables?
Anti-aging cosmetics, anti-aging aesthetics has become one of the most popular interventions in the world. And humans come by it quite honestly. If we think about the animal kingdom, which are the animals that get to mate and produce the next generation? These are the pretty ones. The birds with plumage are the ones that get the mate. The lion with the big mane is the one that's attractive. Of course, the strong ones as well. But aesthetics in animals, in birds, in plants, in flowers, even, this is what creates the next generation. So it's only natural that we as human beings want to look our best, our youngest, our healthiest, our most well nourished, and our strongest. So that's where anti aging cosmetics comes in. So we take non invasive techniques, it means non surgical. And the range is creams, machines, and injectables. Let's focus on the injectables. So the injectables, we all know about the botulinum toxins. That's the neuromodulators, Botox, Xeomin, Dysport, Nuceiva. We have all the brands here. And they can make you look more relaxed, lift up eyebrows, lift up the corner of your mouth, stop you from looking angry, tired, unfriendly most of the time. But the key is to look natural, and the botulinum toxin, the neuromodulator injected, needs to be undetectable. That's the new buzzword in anti-aging aesthetics. As far as the fillers go, we've all been put off. If you can see the filler in somebody's face, that is a bad job. If you can see huge cheeks sticking out like this, the so-called filler face, that was an inexperienced practitioner or a practitioner that's allowed the patient to browbeat them into overfilling, or they're just too greedy, they're putting in too much. So the key is to put filler in, dermal fillers in, and hyaluronic acid is the most popular in the world, to pull back, to lift, to tighten. We're not filling. We're not creating huge big cheeks, filling cracks. We're filling and lifting and tightening. This is the key to injectables. And then we have to decide, do you want an instant look, an instant filling, lifting, and tightening? Or do you want a biostimulator, which is going to go in and then slowly grow collagen? And we have a number of different options in those fields. We have the hyaluronic acid, the Restylane, the Juvederm, the Belotero, the Teosol, the Revinesse. Those are the hyaluronic acids. And then we have the biostimulators. That's the Radiesse and the Sculptra, the PLA and the calcium hydroxyl These are the biostimulators that we inject in, and then they slowly stimulate collagen. Well, why not have both? The best aesthetics is undetectable. Nobody should see what you've done. They should just know you look good, you look refreshed, you look healthy, you look vibrant. That's the way to optimize your non injectable anti aging cosmetics.